This is all. Just sit back and enjoy the ride, boys.
What a ride it's gonna be. You're not in the picture. What happened? How'd you get out of the picture? You got to get next to Doc. There you go. Oh, look at that. Now, Lizzie is not with us tonight. Do not be upset. In her absence, though, well, Linda, you tried. And I respect the fact that you tried.
I did try. Mm-hmm. I just don't fill her shoes
out a shirt the way
as well. I fill out her shirt as well.
What's wrong with this microphone?
My microphone? Who needs a microphone?
There it is.
We don't need no stinking microphone.
I'll just yell from across the room. That'll work. Thanks.
I've got the booming
Dr.
voice.
Klein. Do you?
No,
This
not really.
is why we have soft opening. Sako Japan.
Sako Japan.
Sako Japan.
All right, so tonight we're supposed to talk about skincare and how to save your face and the rest of your body skin.
Yeah, and how does
it's
this
a
get
big
into
organ,
connections?
right?
Yeah, it's a big organ.
It's
It's the biggest organ out there.
Yeah. So what's it all about?
Yeah.
Because your skin is that's the only thing separating you from your loved ones.
Yes, they're dead. Yeah,
Figure that
right. The only thing that gets between me and my Calvin Kleins.
I just got a dirty look from my wife.
Did you get a dirty look? I thought so.
It was a good one.
By the way, loving the headphone hair. Very sexy.
I don't know. That was kind of front. She gave you front face.
She did give you a front face.
She gave you front face, which is a little
front.
different.
All right. So anyway, so the show's going to start in just a moment here. We're just getting all the bugs out, if you will. You guys seem so dark over there. Why are you so dark? Hold on. Why do you look so
depressed?
dark?
We're from
Depressed.
Sako
Yeah.
Japan.
Sako Japan.
Oh, I
I'm
see.
trying to light
Since
you guys
I'm
up.
blocking this.
Are you blocking my light?
Yeah.
The sun.
Walk
Don't
into
let the
the light.
sun
You know, speaking about
Go to
walking
light,
into
Carolyn.
the light.
Why would you do that?
Light.
Why would you walk in the light? Well, if you knew that was the curtain call, you would probably walk the other way. However, so I was talking to a patient today about how things were going.
And she
It's
walking
better
in the light?
to be seen than viewed, is what it came down to.
Yeah, that's true.
Yeah.
What's
Yeah,
it?
indeed.
Better to be judged by 6 or 12 than carried by 6 or something. Something like that.
Yeah, there you
That's
go.
another one of those ones. Anyway, all right, let's start this shindig off because why? Why not?
We can.
We can. Still in pain. Oh yeah, for the next few weeks.
Really?
man.
Yeah, I know. Hey. You fall down.
I thought that yeah.
Live from the Connections Studio Suites.
Out.
It's Connections. Connections is relationship radio.
Well, hello there, everybody, and welcome. It's the show you wait for to stop. No, that's not true. Is it over yet?
Not enough commercials.
Oh, yes, we do have commercials. There's always going to be commercials. Not to mention it's Connection Show. That's right, Relationship Radio with a twist, sponsored by Stages of Life Medical Institute. Please support our sponsors. Oh, my God, he's here. Dr. David Klein's the man. We got, wait, where's Lizzie? Cornbread couldn't make it here. All right, no, she's in traffic, actually, so she probably won't make it tonight. But in her stead, we have Linda Nunez.
From Nunez Productions.
Hola.
Hello.
Hello.
Hola.
Hello.
Hello. And from, of course, Stages of Life Medical Institute, already introduced, but nonetheless, the man, the plan, everybody, Dr. David Klein. All right, so tonight, I'm Melissa Fox, by the way. Tonight, we're going to be talking about your skin. It's the largest organ. I know I build it that way. I know you guys were like, don't. I got you. No. The largest organ really is your skin. And it's funny because when you ask that question, people really, they
Don't get it.
They do not realize that, immediately they think of something anatomically different.
Yeah, the only time you realize that it's the largest organ in your body, okay, is when you're eating chicken wings. Right? I mean, you strip the skin off, there's not a lot left. Truly. It's the way it is with our body as well. So much of what we've got is covering, and what's underneath is sometimes less than stellar. So what we're going to talk about, what I'd like to talk about, is what can you do? What can you do? Okay, what interactions can you do with your skin? What care can you do? What sorts of behaviors can you do that are going to provide you with a better covering? So if you were your car, okay, just your car, you would understand, especially here in Florida. There are going to be people listening to us from elsewhere.
Right.
But in Florida, you learn a few things. One of which is that if you park your car out in the sun for any length of time. It lightens it by a bunch of shades. So when it comes time to have body work done because some uninsured clown hits you, okay, you can't ever get your car to look right again. Even the plastic on the headlights will frost over from the ultraviolet light that's beaming down hard on us. So what do you think this does to your skin? You think it's doing you any great favors? If it frosts the plastic on headlights, okay, and it doesn't take very long for this to occur, what do you think it does to your eyes? You know, something called cataracts, not to be confused with Rinkins, okay?
Oh, Rinkins?
Rinkins, yeah, that's pretty good, huh? Not
Cataracts
bad.
and
That's
Rinkins.
a doctor joke.
That's funny. Surprise.
So,
Is it like Saturn? It has ringus?
Rinkins.
Linda from the cheap seats. Okay.
There we go. So what can we do? And what should we do to protect our skin? What can we do in terms of food? What can we do in terms of, let's say that the sins of life that are going to make your skin better or worse? So different people age at different rates, and we all know this. You know, Aunt Sally, she looks a little old for age. She kind of looks like a wallet, and she's only 40.
A wallet.
Okay, a wallet. Well, what's it all about? How much time did she spend in the sun, in the sunshine state, or even the sunny state of California? You know, they look really good, the nice blonde hair, and then when they hit about 40, they start looking like, yeah, I know. You know.
It's bad.
The good Miss Summers out there is a really good example of this. So what can you do to make yourself worse? If you know what you can do to make things get worse, you know what you can avoid to make things stay well or improve, actually. Number one, again, is stay out of the sun. That's the number one killer of the skin in this state and elsewhere. It will prematurely age your skin. Not a bad thing. Okay, not a bad thing at all if you want to start looking distinguished like me. What else will it do? It's associated with an increased risk of skin cancer, all types. Basal cell, squamous cell, but melanoma is the big one. That's the one that kills even the youngest of people. You know, so it doesn't take much to get you into trouble with sunburn. One sunburn, something that we've all experienced, is enough to increase your risk of skin cancer in a very measurable way. And if you do this multiple times over the course of your life, it increases the risk of ending up with bits and pieces of you chopped away.
You should talk to the sunflower girl over here.
Yeah, well,
I've already had bits and pieces chopped away.
Bits and pieces. So, you know, we have a retirement community not too far from here. In fact, the state is one large retirement community. But just west of here, it's a place called the Villages, and there are lots and lots of people out there with some age on them. They have STDs because other things didn't age the way their skin does.
Hello, Viagra.
I love
Hey, look,
Dr. D.
you know, it works that way. You know, I mean, you got to hand it to folks. You know, so if they're on their way out the door, they've retired, they're out there playing lots of golf, pickleball, tennis, but then they also knock around in other ways. Yeah. So, you know, what do you do? You know, you look around and you're going to see people with these clefts in their ears, where their ears have been chopped to little tiny pieces.
Or their nose.
Their nose. Yeah. Any place that is perpendicular to the sun is likely to end up with basal cell or squamous cell carcinomas on them. The ones that kill you are the ones you don't see, and those are typically the melanomas. And they tend to metastasize before you even realize they're there.
You know, that one where you go to the doctor and they look at every little crevice and crack and back of your body and all that, that's a good call.
That's worth it. It's worth doing. I went on Friday.
Yeah.
Okay. It's just a little odd to be standing there like a
completely naked.
Yeah, it's like, hello, I'm here in my oldness.
And he's got a ultraviolet light on his eyes.
It's impressive.
It is.
It really
impressive.
is.
It's impressive. And so in any event, getting out of the sun is number one. If you are in the sun, you need to use a heavy SPF skin covering. You know, these sorts of suntan lotions, sunburn lotions are very, very important. But when you go cheap, the cheap ones are worth every nickel that you're doing on there because they sweat right off. They may only last 20 minutes.
Most of even the expensive ones only last about that long.
They constantly say reapply.
1 hour.
Yeah, they say reapply constantly.
1 hour. Okay, so how long do you really need to be out in the sun anyway?
10 minutes, 15.
About 10 to 15 minutes. That's more than enough time to enjoy. See, I did it. You don't even... Okay, getting vitamin D. Well, you need to go out in the sun to get vitamin D, which is really one of the most incredible of all lies that there is.
It's a lie.
It is a lie. It's not just inaccurate.
Well, we just can't pull that much vitamin D from the sun, can we?
No, it doesn't work that way.
Yeah, exactly.
You're not pulling anything from the sun. The ultraviolet light at a certain frequency changes a chemical called vitamin D2, which is produced by your liver from another chemical called vitamin D1, and it converts to D3. So the sun doesn't make the vitamin. What it does is it permits the conversion of D2 to D3. So most people that are D3 deficient are D3 deficient not because they don't have enough sunshine in their life, but because they don't have enough D2.
Oh.
So what do? You go buy the stuff. It's cheap. Vitamin D3 is pennies a day. And what does it do? It cuts your risk of cancer in half. It cuts your risk of MS by 40%.
Why wouldn't you do it?
Because
Well,
people are
silly.
pretty stupid, and they generally are very cheap.
And they
if
listen
they're
to
not-
people on the
if they're-
internet
you
and
bet.
not their doctors.
If they're not stupid, not cheap, then they're lazy. There aren't that many reasons why you wouldn't do this.
Stubborn.
The best vitamin D3 you can get, which we produce actually at Stages of Life, is $6 a month.
It's crazy.
Okay, why?
Why not?
Okay, because it's not expensive to make. So what we do is we formulated it in olive oil. Why in olive oil? Because it absorbs better.
Slippy.
Yeah. And so what does it cost? It costs as much as it does to make 100,000 tablets in olive oil. It's not that big a deal. But it does make a difference when you're measuring D3 levels, which we do routinely with our patients twice a year, because that's all Medicare tells us we're allowed to do.
Yeah.
So what else do you want to do? What else influences your skin? What can you do? What can you go out and do right now to age your skin prematurely? And the answer is smoke. Smoking cigarettes will age you faster than just about anything but the sun. You smoke and go out in the sun, you're going to be in for a surprise before very long. It's very interesting how this happened. But again, it's the largest organ in the body. You need to take care of it. It's the largest organ of excretion. What does that mean? I mean, you're thinking your
Sweat.
liver.
Sweat.
Oh yeah, it's
Sweat.
your no,
Sweat.
sweat's only part of it.
Really?
It's not your liver. It's not your
Oils.
kidneys. It's not your lung. Those are the other three. But number one is the skin. So you can smell toxins on people. So if
Yeah.
somebody comes in after a bad night drinking, you can
true.
smell the alcohol on their
Yeah.
skin.
Yeah.
If somebody goes out and eats bad food, especially things like coconut oil,
Hmm.
they'll start stinking like old people. Why? Because the omega-7s will do this.
That's
Your-
my
your
favorite
skin-
smell.
It's my least favorite smell. It kicks out toxins. You have to understand how this works. There are certain people that go into liver failure, and you can smell the toxins coming out of their skin. Anybody who's worked in a VA hospital knows that smell well.
All right, stand by, guys. We got to take a quick break, pay the bills, as they say. And then we'll be right back. We're going to talking about your skin and how nutraceuticals and stuff can actually save your life.
Yeah.
And you're not going to look like a handbag. That's pretty much the deal.
Yeah.
Stay right there.
Connections is Relationship Radio.
This is a test. We'll be conducting a test for the emergency broadcast thing. Remember, this is only a test.
This is an amazing set of highballs.
Really is.
It's Connections.
Wow, welcome back.
Thanks.
I feel like an Olympian right
Don't you?
I know,
Don't you?
right?
now. Yeah, I just grew 2 inches.
I want to light a torch or something.
Wait a
You wanna
minute.
light a torch?
Wait. What? All right, we're talking about skin and how to keep it healthy with nutraceuticals. We're not talking about nipping and tucking and all the other crazy
We
stuff.
could, but we won't.
Why should we?
Yeah.
Because there are healthier alternatives to keeping yourself going. Got Dr. David Klein, Linda Nunez. Is
Oh,
in
you
the
did it
seat.
again.
What?
That was fun. Remember the first time I was on your show?
Yeah.
Yeah.
I can't
Half an
pronounce her
hour
name.
pronouncing my last name.
No,
right?
what I was
Awesome.
trying to
A lot
say
of
is
practice.
Oh, yeah.
hashtag Lizzie said what is not here. Linda Nunez is here, and I all went.
That's not me, boy.
That's right.
Yeah, nicely done.
Thanks, that's pretty good.
That was excellent. If
There
I
it
didn't
was.
know any differently.
And Melissa Fox,
Okay.
2 X's. So we were talking about the skin. We're talking about vitamin D, being outside in the sun, not worth it.
Yeah, and so the last piece of what you're not going to do after smoking, after laying out in the sun, is sucking down a bunch of sugar.
Oh.
Because the sugar itself will age your skin. It will cause pimples to form. Okay, that's just the way that goes. That's temporary. It's not that big a deal. But the sugar itself is inflammatory and has a tendency to cause blood vessel changes. It's not a good thing.
I
So
thought
have
you were
to
going to say
stop it.
drinking.
No drinking. No, drinking's fine. There's nothing wrong with drinking. Too much drinking's a problem, but it doesn't really bother your
Unless,
skin
of
as
course,
much.
you're
I'm
within
so glad to hear him
childbearing
say
age,
sugar because a lot of people don't realize.
Sugar is
Sugar's-
like cocaine,
it's
man.
poisons.
Yeah.
Crack.
It is more addictive than cocaine. So what are the hidden secrets? What are the secrets the doctors don't want to tell you?
Doctors gotta say,
Okay,
4 out of
now this will
5
get your
dentists.
attention. This will get your attention because this is the secret that docs don't want you to know.
Okay,
Why
listen.
don't doctors want you to know that about something that's healthy? Just ask them what they're doing. They'll tell you. Now, that doesn't mean they're right, but it does mean they're more likely to
Now,
be
is this
right.
the doctors from the 50s, 60s, and 70s who would chain smoke a cigarette while...
More doctors drink.
my
no,
gosh,
no,
wasn't
no.
that crazy?
More doctors smoke Chesterfields
I
than
know-
any
I've
other
seen that
cigarette.
ad,
I
yeah.
have that
I know you
advertisement.
do.
It's framed up in my office
Crazy.
because
Wow.
yeah,
With
because
the cigarette dangling, the kid in there, you know.
more
and
doctors smoke Chesterfields. That may well have been true. Who knows?
Who knows, man?
Who knows? But in any event, the hidden secret is actually oil.
Oh.
Oil is the key.
Oil?
Oil.
Yes.
You wouldn't necessarily think this, but
Look at the
oil is
Mediterranean
what it's all
diet.
about. Mediterranean diet is rich in olive oil. Is that the only way to do it? The answer is
No.
no. Olive oil comes in a bottle, believe it or not, and sometimes comes in a crock, and often it comes in a barrel. But it doesn't really matter what the vessel is. But oil is the secret to skin health. And if you don't know this, don't believe this, can't understand how this operates, ask any teenage kid in the 4-H. Now, for those of you that are city dwellers, that's where the farmers' kids go to compete with cows, bulls, sheep, and whatnot. You know, sometimes they win the race and sometimes they don't. I'm not sure how they compete, but what they find is that their cattle, their dogs, their cats, whatever it happens to be, always have a shinier coat and look healthier if given a slug of olive oil regularly in their diet. It makes their coat look good. Wouldn't you know? You have a coat too. Look, it's called your hair, it's called your skin, it's called your nails. It works for horses, it should work for you. So it's necessary for skin flexibility, sometimes known as turgor. Okay, it's necessary for skin turnover. You start looking more youthful, and it is one of those kinds of things that's necessary for general health and vascular stability. What does that mean? It means that you end up increasing blood flow. If you increase blood flow, wouldn't you know it? The skin, bones, joints do better. So things that are vasodilators, opening the blood vessels, are almost always better for you in terms of general health. So these are the things that you need to be doing. So we're going to start with the omega-3 fatty acids, or EFAs. So omega-3s, alpha-lipoic acid is the least of the bunch. It's an anti-inflammatory as well as an antioxidant, but it's a marvelous antioxidant, best antioxidant. EPA, eicosapentaenoic acid, and DHA, which is docosahexaenoic acid. So these are the 3 major components, the 3 major omega-3s that are present in fish oil as well as olive oil. And you can pick and choose. Fish oil I prefer because it's a little bit closer to human ratios than is the olive. Why? Because it's an animal as opposed to a plant. But there are people out there that believe that plants don't have souls. I am a gardener. Okay, I happen to know that plants have feelings too. So just because you're eating Elsie the cow doesn't mean that Elsie has better feelings than maybe an olive tree.
Hey,
Okay.
I'm just going to say, you sing to your plants.
So omega-3s.
They
So
have
omega-7s,
feelings.
interesting if you want to smell like an old person. So
About
what else?
9s?
What other kinds of things do you want to get into? So the omega-3s, you want to be taking about 1,500 to 1,800 milligrams of those 3 combined, those 3 omega-3s
A day?
per day.
Wow.
It's not that much, okay? But it's necessary. And then certain vitamins. Why are you interested in vitamins and minerals? Most people, you know, they lump it all into one word, vitamins and minerals, vitamins and minerals. Well, they're different, aren't they? How many different vitamins do you think there are? Well, there are over 50 just in the B vitamin family, 50. Look at your B vitamin that you have on your shelf, and there are going to be
12.
6, okay? That's it, right? Yeah, but there are 50, okay? So some of them are minor, okay? Some of them are a big deal. But the one that's most important to any particular individual is the one that you're missing. Okay, and if you don't, you know, it's just the way that it works. The one you're missing is the one that's most important to you.
All right.
So when you're looking at vitamin and mineral products, and the difference between a vitamin and mineral is they're both enzyme cofactors. They're both necessary for a multiplicity, 1,000, 1,500 different chemical reactions to take place. But a vitamin is an organic chemical and a mineral is an inorganic one. That's the only difference. You need both, and you need to have an adequate supply. Getting more B vitamins than your body needs is rarely a problem. It can be, but it's rarely a problem because your body has means and mechanisms to dispense with it. Minerals, on the other hand, are different. If you don't have enough, you can get very, very sick. Diabetes, hypertension, thyroid disease are the 3 very common ones that come from certain mineral deficiencies that we'll do on other shows. But if you have too much selenium, too much vanadium, too much chromium, too much zinc, you can die. So too much of a good thing can become a bad thing very rapidly when it comes to minerals. So you need to know what you're doing. You'd better get good quality advice when you do this. Good quality product. You want something that's assayed, that means measured, and you want to get something that is made in this country, not some garbage that's coming in on a slow boat from China.
And why not?
Because your body is the only one you are issued. And it does not come with a guarantee, and it doesn't come with an instruction manual. So you're expected to use a certain amount of judgment, and part of which is how do I best protect myself and how do I protect this machine that I was given on loan?
Which reminds me of a quick question I wanted to ask you.
Yes.
Why is it that we have to keep replenishing these vitamins or vitamins and minerals? Why isn't our body either making more or why are they depleted?
Good question. Well, the story with a vitamin, it's an enzyme cofactor. What makes it vital, what makes it a vital amine, is the fact that your body can't produce it. It has to be bought and brought in from the outside. But because you have turnover of tissues, you are losing lots and lots of this every time you slough off skin, and you slough off cells all the time. You are turning over cells constantly, and you are losing it in that tissue.
So we need to look at vitamins as a consumable.
It is a consumable.
In our bodies.
It is a consumable.
Okay. And we have to keep you.
That's a great way to look at it.
Replenished.
Yeah, and it's in some way I prefer to think of it, and that's a good way to do it, by the way, as if you were breathing. You know, how many times a minute do you breathe? Between 10 and 16. Yeah. When you get 18 to 20 or tachypnic, you can actually see people breathing.
That's too much.
You know, if you can see somebody breathing, you notice that they're breathing too fast or too hard. There's something wrong.
Right.
Okay, you should not be able to perceive somebody else's breathing. So if I asked you, well, if you're breathing 10 times a minute, why don't you hold your breath for the next 7.5 minutes, and then you can make it up in the next 10. Catch up later. Well, you can't because you'll be dead. So your body doesn't bank breathing. It doesn't bank heartbeats. And it doesn't bank vitamins and minerals.
Okay, all right. Well, I needed to know because I thought if we're like losing them somehow, or if we're not eating the right food somehow.
Well, that's it. Okay.
I'd like to ask a quick question while we're on oils. I was recently at the eye doctor, and she mentioned krill oil.
Well, okay. Tell her to stick with her eyeballs.
Yeah, okay.
Right. Okay. All right. Yeah.
Yeah,
she'll do better.
Too,
she'll do better with refraction than she will be with
I love it.
With physiochemistry.
Vitamin A and retin.
Yeah, that is bad advice, especially coming from somebody that claims to have a doctorate.
Oh dear. All right. And on that note, great question, Linda.
We'll come back to that in a moment.
Right. Yeah. By the way, Linda Ball on our website says, I think the term old bag came from an older woman in Colorado who looks like a leather face.
Yes. Linda, thank you very much.
Out there in out there land, it's time for the biggest, baddest party in the world. So get on up, turn it up a notch, and get ready to boogie, baby.
You know, that wouldn't shock you. Ever been to Colorado?
No.
I have. Okay,
Yeah, I have.
My wife Tess here is from Colorado.
Really?
Okay, next to South Florida. Okay, there are more
Old
ratty-looking old bags there than any place else. Yeah, I mean,
I've heard
it's just,
Steamboat Springs just breeds them.
well, yeah, and they don't believe in wearing any makeup, so they really show off the crevices. It's pretty awful, and you can't guess people's ages there.
No.
I mean, really, you have an awful lot of people of pre-Medicare age that look a whole lot older than I do.
Lord, oh, stop. So we're talking about skin today, your biggest organ. I know.
Yeah.
I know, guys. Sorry. Hate to disappoint.
Well,
but it really is your skin.
Yeah, it is your skin, generally speaking.
And we talked about what not to do. We've talked about how important oils are important.
Important.
Yes.
Very important.
Hey, no.
Yeah, right. Hey.
Hey, when I was 44, somewhere in there.
You didn't tell me you're that old.
I am that old.
No, really.
I had a pre-melanoma.
There's no
Which
such
means
thing.
melanoma. They just wanted to be nice to you.
Yeah.
Really?
Yeah, melanoma is melanoma.
Yeah, there's no
Cancer's cancer.
pre.
It's like, well, gee, I'm pre-pregnant.
Yeah.
No.
It doesn't really work
It
that
doesn't-
way.
no.
I did not know that.
Nah,
They were
you're
leading
learning.
me to believe that it was probably going to turn into a melanoma, but it hadn't gotten there yet.
The switch doesn't work that way.
No.
It doesn't work that way.
Interesting.
They just didn't want to
They
scare
were being
you.
liar to me.
No, what they were was
No.
they looked at it, and sometimes there's low-grade melanoma that you can't really be sure if it's bad or not, so you cut it out.
Oh, they cut it out
When
twice.
in doubt, you remove it.
Yes, they
Okay?
did.
So the diagnosis of melanoma is a particularly difficult pathological diagnosis. Frequently, there are pathologists out there that specialize in melanoma. Okay, that's the way these things go.
I had a skin doctor tell me that you can actually develop skin cancer and then it can go away on its own.
Absolutely.
Yep.
And I couldn't believe that.
Yeah, it happens all the time.
Yeah.
You develop lots and lots of cancers on a daily basis that
Sure.
don't progress. It's something called your immune system that's necessary for this to happen.
Oh.
So, but finishing up with krill oil.
Okay,
No,
here we
because
go.
this is important because there are
Krill
bound
oil.
to be
Isn't that like whale poo poo?
no, there are bound
No,
to
that's
be.
the,
It's a little
the
teeny
fish
tiny
that
fish.
they eat,
Yeah,
right?
yeah, a
So-
bajillion krill out there make
Right.
one meal for one, sperm whale.
Wait, it's the crap
Blue
that's
whale
on the
grabs it.
bottom of the ocean.
It's on the bottom, it's on the top.
No, it's
It's
just
on the
the
top.
small little fish that the whale just.
But why
Silk.
krill?
Yeah.
What's so special about krill other than the fact that you spend a lot of money for probably the least valuable oil product that there is?
Yeah.
Because, well, it's higher on the food chain than sardines or anchovies.
Her claim was it might help dry eye.
No, it doesn't. DHA helps dry eye. Okay, what we'll do is if there's anybody out there with dry eye, I'm going to teach you how you treat this without spending a ton of money
Poke
at
myself.
the
Anyway.
behest of an optometrist or an ophthalmologist.
There
Okay.
you go. It's
Aye,
way
aye, aye.
DHA.
My eyeballs on the floor.
Docosahexaenoic acid. You've heard me talk about DHA.
Yes.
Okay,
Okay,
DHA
yeah,
is a portion of fish oil.
Uh-huh.
All right, it's the
It's a very
second most
slight
prevalent.
lubricant.
Second most prevalent of the omega-3s in fish oil. So, how much do you need of DHA per day for
Not
dry eye?
much.
You know, the answer is about 1,000 milligrams a day of DHA for dry eye. Individuals with Sicca syndrome, with these autoimmune disorders where their eyes dry out, between 500 and 1,000 milligrams of DHA. Now, you never find DHA by itself.
No, dry eyes and those kind of they're over the counter, but still they have a little portion.
But it's not very good. Okay,
No.
you're wasting your money. But DHA typically comes in a 2-to-1 ratio between DHA and EPA when distilled for this purpose.
Okay.
That's what you're looking for dry eye, and it's so much less expensive than the products that have anything that say "I" on them. Okay, if
Wow.
it says EYE, I, okay, then you're gonna be spending way too much money. Doesn't make any sense. So why not krill? Because you have to take 20 to 25 krill capsules per day
Oh my gosh.
to get the same amount of EPA and DHA that we have in 2 capsules of Heart and Soul, which is Stages of Life product. Stages of Life product is $20 a month. That stuff would cost you about $70 to $80 per month
Oh, that's
for the same
ridiculous.
amount.
Again,
it's silly.
And you'd
Stages
be
of
swallowing
Life
pills
vitamins.
all day long.
One bottle lasts you 2 days. It doesn't make any sense.
StagesOfLifeVitamins.com for any products referenced, including Heart and Soul.
Yeah, which I take on a daily basis, and I contribute my good looks to that. So, but what else are we looking at? And this is going to be another important little ditty.
Might want to pay attention.
Yeah, in other words, pay attention to the doc at this point, and it's free radical scavengers. So what's that all about? Well, those of you that are spending a lot of money on vitamin E products that are sitting around in their on their chest or whatever, not that chest.
No.
Okay, no. In their medicine chest. Those are free radical scavengers. So when you're looking at antioxidants and free radical scavengers, these things are necessary to help with chromosomal damage as well as collagen damage that happened as a result of sun
Sunburn,
exposure.
yeah.
So what do I prefer? I like particularly one called N-acetylcysteine.
Oh, yeah.
NAC because it's inexpensive, easily absorbed, easily obtained, and this stuff has multiple other salutary, that means good, effects.
Do you have that back in?
Oh, yeah, we
I got
have
the
it.
folic, but I didn't get that.
Yeah, hyperfolic, which is our high-dose folic acid, is a methylator. It's also a detox. Very, very helpful for a bunch of different reasons. So typically what I have people do here in Florida is I'll have them on N-acetylcysteine when they ask me, okay, N-acetylcysteine and high-dose folic acid. What's high-dose folic acid? The answer is 5,000 micrograms, not this 400 microgram garbage that you can buy at the health food store. It's an odd, but it's all dose-driven. You have to take enough of things to make things work. If you don't believe that, try drinking a thimbleful of beer and tell me that you feel anything. The answer is no, because you know inherently that that's not enough alcohol to really impair anybody. It doesn't work that way. And the same thing is true with vitamins and minerals. Thyroid hormone levels. Very important for the skin to work. Why? Because when you're hypothyroid, your skin turnover decreases. Your nails slow up, your hair becomes thick and brittle, your nails turn white, and wouldn't you know, the skin starts to age prematurely. So you need to get the thyroid level going. And your gonadotropins, things like progesterone. So we use topical progesterone, over-the-counter topical progesterone, as a wrinkle cream. Does it work? And the answer is yeah. It doesn't take long for the stuff to kick in. So these are the sorts of things that you can do. You're empowered to do this. None of these are expensive. They're all readily available. We have them at Stages of Life. If you want to support us, we are happy. If you buy them someplace else, it's at your own risk.
Good luck.
Good luck.
Good
you know,
luck.
and so but you also get me along with it. So, so this is really what this is all about. Is you walk into it, you go quality, consistency, okay, quality, consistency, and you need to go with some degree of rhythm. In other words, you do it on a daily basis. Your body needs these things every day. It's not a matter of, well, gee, I'm going to do it now, but I won't do it next week. It doesn't work. So when I take vacation, my wife and I take vacation now. It's our 3rd anniversary today, so I need to be more inclusive of my wife tonight. We take our vitamins with us, and it's actually one little satchel. Okay, that's the size of most women's purse for both of our nutraceuticals. And these are not in the bottles; these are in little satchels. Why? Because if you're going to take a week off, it takes a lot of volume to do this. Is it worth doing? The answer is yeah. I'm not going to take a vacation from my health, and nor will you.
No.
Okay, and so this is
I can't take a vacation. I burn up.
You'll do, yeah. Well,
I mean, I have to have the certain routine, and when I get off of it, it's not just that day that you suffer.
It takes weeks to bounce back.
Exactly.
Okay, when you use the word burn, and that's a good one. So let's say that you burn your skin. How long does it take for it to heal?
Ooh.
It takes weeks and weeks and weeks.
Yeah.
In fact, it's never quite right. You touch it, it's hypersensitive. What happens when you burn the inside of your gut? Reflux esophagitis or an ulcer.
Probably never.
It takes weeks and weeks and weeks to bounce back. Months. Okay, and it's always weakened. You know, when people end up with gastric carcinoma, it's very typically in one little area where you typically get ulcers. So why? Chronic inflammation begets cancer. Wouldn't you know?
Yep.
So what's a sunburn? Anything but inflammation?
Don't you get inflammation with the sunburns?
You most certainly do.
You do. Yeah.
Yeah, and there's some tricks.
You've seen someone's face; it swells.
Yeah. It's
eyes.
awful.
Yeah, it's
so in any event, so the products that I mentioned, okay, and I'll go over it once, okay. One of them is a multivitamin called Down to Basics. Why? Okay, because the skin health, the skin turnover is going to be limited by the piece that's missing. So if you're gonna produce a product, any product at all, you miss one piece, it doesn't get put together properly. So in car production, a lot of cars are being held up because they can't get a $2 microchip. Okay, so it holds up the entire car production. You can't get a refrigerator for the same reason, or they can't get Freon, or you can't get a particular chemical in paint, so you can't get paint now. You can't get this, you can't get that.
I liked your lock, your 12 combination lock.
The 12 combination lock.
11 of them can be there, and if one is out just a little bit,
you're done.
You're done.
So the Down to Basics, if you read what's in this product, okay, it's outstanding with regards to the breadth of the material that's in it, and it's inexpensive. You take 4 capsules a day, 2 in the morning, 2 in the evening, and if you don't buy it on special, it's about $24 a month. If you do buy it on special, it's about $19 and change.
Yeah.
Very, very inexpensive. Fish oil, hyperfolic acid, hyaluronic acid, and then oddly enough, we have one called Kinkies.
All right.
Oh,
And
we love
Kinkies,
Kinkies.
oh no, you don't even know about Kinkies.
No, we love Kinkies.
No, Kinkies for sunburn. So what you do, you get sunburn. You can get a motorcycle burn on your ankles. You put Kinkies on it, it won't blister.
We'll be right back. It's Connections Relationship Radio with a twist. We're learning.
Trying.
Yeah, we're trying to learn anyway. We are learning. We really are, dude. Yeah, stop.
You're listening to Connections Relationship Radio.
Well, the strange thing is, people with that much talent rarely amount to anything.
All right, let's
she
keep
know?
this train wreck moving.
Hi, welcome back to Connections. Yeah, buddy. We are Relationship Radio with a twist. Dr. David Klein is explaining about our biggest organ and how to take care of it without doing nips and tucks, although we could, but that's not a really good way to go.
Yeah.
We've got Linda Nunez with us in place of hashtag Lizzie said what, because traffic sucks.
There you go.
Yeah,
Yep.
so Dr. Dave, continue to tell us about the prescription, non-prescription
Yeah,
drugs.
and
such.
so what you're looking for, okay, and each of these products that I just mentioned, okay, each of them has all of the ingredients listed with concentrations.
Ooh.
Tells you how much is in it. Nothing to hide. Not this proprietary blend of X, Y, and Z. You see proprietary blend of X, Y, and Z, it either means they don't know what's in it, or the product itself is not that well put together.
Right, because it could vary.
It's going to vary.
Yeah.
It means they are not going to keep it consistent. So the Down to Basics product is one that I'm particularly proud of, but it's also the pedestal product for a lot of the things that you do. Because if you're, let's say you're B2 deficient,
Okay.
all right, it ain't going to matter if you can't make up for B2 by taking more deep, B6, let's say. So I've had people come in the office looking for B12. They find the B6 and they take 2 of them.
Oh, there you go, math.
All right. Yeah. I mean, they may have done well in arithmetic. Okay. But the fact of the matter is you don't add up
It's a
people's
nice
addresses
it's a
or
nice
zip codes.
try.
Yeah. You can't do arithmetic with zip codes.
Do a B6
It doesn't
and
work
a
that way.
B3 and then I'd like a
Right.
2, and if I get a 5.
Yeah. So the square root of B9.
Oh, my.
Okay. No, it doesn't. It doesn't work. Okay. These are abbreviations for chemicals that are entirely dissimilar. Okay. They are structurally dissimilar. You can't make B9 out of 3 B3s. It just doesn't happen. I mean, it's a brilliant thing to consider,
It's a
but
nice thought.
it doesn't work that way.
Yeah.
Yeah, you're not
So-
smart.
So what do you do? So hyaluronic acid, I didn't get a chance to mention too much about that, but why is this
Please
stuff
do.
important? But hyaluronic acid comes in different forms. So if you go to the cosmetic counter, it'll sit back and say, well, this is a cold cream with hyaluronic acid. Never tells you how much is in there, right? It's got squalene oil in it. Doesn't tell you how much. Squalene oil is like $1,000 an ounce. Okay, it's not going to have very much. All right.
Wow.
Yeah.
So you have to know what you're doing. Hyaluronic acid, the best hyaluronic acid is actually something called high molecular weight HA. Okay, and the product that I prefer for this is called Lubricin.
Ah, yes.
Is it expensive? And the answer is no. Okay, it actually, milligram for milligram, is less expensive than the stuff that comes in capsules. But does it work? And the answer is yes. What do you use it for? It lubricates the skin. It makes it look really good. If you want to, you can, in fact, use it topically. Just take a dab of the stuff, mix it in with your own cold cream, rub it on your face. But you can also use it if you have bad knees or bad hips or bad shoulder, bad elbow, because your body needs the same hyaluronic acid for these joints, for joint mobility. So arthritis and skin care out of the same product.
Wow.
So I take this stuff. It's about 1 ounce every morning. I stick it in my yogurt, or I stick it in the yogurt that my wife makes for me. And it's a better way to put it. And this stuff is a little bit
He's
sweet.
really trying to be inclusive today.
Yeah, I'm trying. It's a little bit sweet. Okay, it doesn't taste bad, but it does work. Makes your skin really very, very supple and very. It just does the job. It doesn't take long for this to occur. Now the kinkies. Now this is what I want you to think about. Kinkies is marvelous as an anti-arthritic. You rub it on your hands, your feet, they feel better. They move better. Elbows, shoulders, knees, hips, marvelous. But for sunburn, this stuff is awesome. So you get a sunburn, and what you do is you wet your hands down, put some kinkies on it, and then what you're doing is slightly diluting it.
Right.
And you go ahead, lather it up a little bit, and you wipe it on the sunburn. It takes about 15 seconds. The pain goes away, and if you catch it early, it will not peel. Oh. All right? That's kinkies.
Wish I'd known that about a week ago.
Well, you didn't ask.
I know. I just accidentally got on top of my shoulders. And it was you get home and you're like, it's a little uncomfortable.
You put the stuff on, you won't even think about it.
We had it
again.
in the house, and
I know.
I could have done it.
Yeah,
next time we know.
But yeah, or you can dilute it 50-50. You can go to Dollar General, get one of those little plastic containers. You fill it half with kinkies and half with water, shake it up, and then you can use that.
There we go.
So does it work? It works marvelously. It's very, very interesting stuff. You can stick it in your eye and it doesn't burn, which is a little different than a lot of other things. In your eye.
I'm constantly putting things in my eye that burn.
Put it in my eye, Dr. Klein.
Yeah.
I'd rather.
I like it in the eye.
Dr. Klein.
I'm catching,
That is
I'm catching
interesting.
stink eye.
Yeah, I
from
know,
my
I saw
wife.
that.
Stank eye. Yeah.
Stank.
No, but okay.
Yeah. So in summary, Okay, because we're running down on our time.
We're getting there, but we're okay.
Are we?
Yeah, we got like a couple minutes left.
Couple minutes. Okay. So in summary, what you really want to do is you want to make sure that you don't destroy your skin. Okay, this body that you've had is yours only temporarily. Okay, it will die before it's gone. Okay, and then it's all over Irene. So you don't want to be a lousy looking corpse. You want to be a good looking corpse.
Wait, kinky's really, does it make your knees, which is the one that makes your knees not look old and saggy? And why do women worry about their knees so much?
I worry about them.
Why?
I don't like that look.
Don't look at them.
Don't look at your knees.
I don't like the wrinkles on the top.
If you unbutton a couple buttons on your top, nobody will look at your knees. I mean,
That's what
women
I was
will know all
saying.
kinds of tricks.
That's a trick.
That works for Lizzie.
Yeah, I know.
Well, she unbuttons a couple there, and it's.
She doesn't have to button nothing. Buttons don't hold.
No,
ain't no
it's
buttons.
going to take some. It's going to take some duct tape.
All right, so recap this for us before it's time for us to wander away.
So the recap is don't get out in the sun.
Yes.
It's not good for you.
Okay.
Watch or eliminate your sugar intake. Two most important things. Kick up your oil intake.
Oil.
So olive oil, a shot glass or two per day is satisfactory. If you want to use fish oil, use the Heart and Soul product because it's very, very inexpensive and it's a good high quality. You need to make sure that you get the right vitamin and mineral load on board. Least expensive way that I know to do it is with the Down to Basics product, which is, again, $20 a month. Okay, we're not talking these multi-level marketing things, which will cost you $80 to $100 a month.
Oh, gosh. And then not worth it.
Not worth it. Hyaluronic acid, okay, the one that I prefer is called Lubricin. If you guys have any cattle or horses, this stuff is marvelous for arthritis and horses. That's how I learned about it. It was with my daughter's horse. And Kink Ease Lotion, that's K-I-N-K, new word, E-A-S-E. And what you do with it is you dilute it a little bit with water. Tap water works just fine. And you just put it over the burned area, and it settles it down quickly. Is it a sunburn lotion? Yes. Is it a sunburn preventive? No. This is not to prevent sunburn. This is just to deal with the inflammation
And
following.
we're not saying go out, get a sunburn, and then use this because you'll be fine. That's not
Not even close to the message.
Not Plan B, is it?
No,
message,
but you do find yourself getting burned periodically. The top of my
Tess got
head
my
gets
joke.
burned.
Yeah.
Oh, I missed it.
I said it wasn't Plan B.
Oh, yeah, there we go.
Listen, these days getting sunburned is an accident for me.
Again.
I don't want it to happen.
Hey, Mom, I want to go out and get sunburned.
Yeah,
it's
the worst feeling in the world. I hate
You're right.
being
Hello,
sunburned.
it's your skin.
But
Please
it's
don't do
nice
that.
if you can.
The
if
worst
you, if
feeling
it
in the
happens.
skin. No, the worst feeling is getting sand in your bathing suit.
No.
That's
The worst feeling is getting frostbite on your skin.
that'll work.
I mean, you guys have not had
That doesn't sound fun at all.
It's not fun. It's the weirdest burning sensation, as your foot is not getting any feeling in it, but there's a burning sensation, and you can put a pin right in nothing.
Ever
Nothing.
been waterboarded?
Yeah, once.
Okay, it's fun, isn't it?
It's not really all that fun. Yeah.
Oh, we'll do another whole show
like
on
the
waterboarding.
mustard
Let's
gas.
do that.
I know.
Nasty too.
Any of y'all have been in the military, you know the joke.
All right, you guys. We'll see you next time. Thank you, Dr. Klein.
It's my pleasure, and you guys have a good week.
See ya.
Adios.
Laughing time is over.
There you have it, boys. Case closed.
You've been listening to Connections. Find tonight's show and replays of our past shows on connectionsshow.com.
If you're